Today's video, we're diving into the essential topic of foods to avoid during pregnancy. Your baby's health is paramount, and we're here to guide you on this incredible journey. During pregnancy, what you eat matters more than ever. We'll explore why it's crucial to avoid certain foods, including the hidden dangers of bacteria like Salmonella and Listeria. Your health and your baby's well-being are our top priorities. Stick around as we provide you with a comprehensive list of foods to steer clear of during pregnancy. From raw meat to seafood high in mercury, we've got you covered. Knowledge is power, and we're here to empower you to make the best choices for your growing family. But that's not all. We'll also share tips on how to ensure the food you eat is safe and discuss foods you should limit during pregnancy. Stay tuned for some valuable insights that can contribute to a healthier, happier pregnancy journey. So, if you're ready to learn about the do's and don'ts of pregnancy nutrition, hit that subscribe button and ring the notification bell. Don't forget to give this video a thumbs up and share it with any moms-to-be or parents who could benefit from this essential information. Let's embark on this incredible journey together. When you're pregnant, the needs of your baby come first. Because of that important change in your life, there are certain foods to avoid during pregnancy. Removing these foods from your diet can keep you and your baby happy and healthy through all 3 trimesters. Number 1. Raw meat and fish. Raw, smoked or undercooked meat and fish, like sushi and sashimi, are at the top of the list of foods to avoid during pregnancy. They carry a risk of norovirus, Salmonella, Listeria, Toxoplasma and E. coli, says Camila Phillips, MD, IBC-ELK, an OB/GYN and Philips Sonicare expert partner. Certain bacteria are killed only by heat, so raw and undercooked meat and fish pose an increased likelihood for food poisoning. You'll also want to steer clear of raw shellfish, including oysters, clams and mussels, as these could have algae-related infections, the American Pregnancy Association, APA, says. To avoid catching foodborne illnesses, the APA recommends cooking whole cuts of meat to 145 degrees Fahrenheit, ground meats, like hamburgers, to 160 degrees Fahrenheit and chicken breasts to 165 degrees Fahrenheit. While these are the recommendations, use your best judgment to ensure the meat you're consuming is fully cooked through. Number 2. Seafood. Seafood that's high in mercury. The FDA lists king mackerel, marlin, orange roughy, shark, swordfish, tilefish and big-eye tuna as high mercury fish to avoid during pregnancy. Mercury accumulates over time, and because certain large fish live longer, they store more mercury in their flesh, explained Sarah Krieger, mile per hour, RDN, a registered dietitian and nutritionist. Mercury accumulates in people too, and, as studies have found, it can disrupt fetal brain, hearing and vision development. Instead, opt for low mercury seafood. More on this below. Number 3. Unwashed vegetables. Also on the list of foods to avoid during pregnancy? Unwashed vegetables, such as lettuce, salads and raw sprouts. According to the FDA, these pose a higher risk of food illness for pregnant people, as they can harbor bacteria such as Salmonella, Listeria and E. coli. Any raw vegetable that swims in a pool of water in its package is at high risk for bacteria, says Krieger. While washed, packaged salad is okay, you'll want to eat it within a day or 2 of opening it. If you want to be super safe, cook your veggies before consuming them. Number 4. Raw dough and batter. Sensing a pattern? Pretty much anything raw is off the table during pregnancy. You might be craving raw cookie dough, but, for baby's sake, resist licking the spoon when you're baking. Dough and batter contain raw eggs, which pose a risk for salmonella and foodborne illness. But take heart, some commercial cookie dough lists pasteurized eggs in the ingredients list, so those should be okay from a food safety standpoint. Number 5. Deli meat and prepared deli foods. Deli foods are high on the list of pregnancy foods to avoid. Cold cuts, including ham, turkey, bologna and more, cured meats, like salami, pepperoni, prosciutto and chorizo, and hot dogs are actually dangerous for you and baby, Phillips says, as they can be contaminated with listeria. You can have them if you heat them up to at least 145 degrees, 165 if it's leftovers, as this will kill the bacteria. Still, it's a good idea to avoid the deli counter altogether during pregnancy. The problem with prepared deli foods, Krieger says, is that you don't know how long they've been sitting in the refrigerated case, what the temperature is in there, and if it stays at a consistent 40 degrees or less, and whether all the ingredients in a salad or dish have been pasteurized. Instead, make your own potato or pasta salad and other deli favorites so you know exactly what you're eating. Number 6. Unpasteurized cheese and juices. Unpasteurized essentially means raw, so you can add any unpasteurized items to your list of pregnancy foods to avoid, including select cheese and fruit juices. The FDA notes that soft cheeses, like brie, camembert, blue cheese and queso fresco, made from unpasteurized milk contain a higher risk of illness. Always check the label when buying cheese. Many soft cheeses sold in U.S. grocery stores are in fact pasteurized, but it's important to confirm. And while other types of cheese, like feta or mozzarella, are typically pasteurized, not all are. If it's fresh or homemade, like some small batch artisan cheese, ask the person that prepared it. When in doubt, skip it for now, Krieger recommends, as unpasteurized cheese can carry listeria. Instead, go for a safer slice, like cheddar or Swiss. Just like cheese, unpasteurized juice or cider are also on the list of what not to eat during pregnancy. If you're at the farmer's market and aren't sure if the juice or cider is pasteurized, it's better to ask or pass. Plus, be sure to check labels while grocery shopping, as the FDA requires warning labels on any fruit or vegetable juice that hasn't been pasteurized. However, the agency doesn't require labels for fresh squeezed juices or cider sold by the glass, like at health food stores, juice bars, farm stands and apple orchards. Krieger's rule of thumb: if a fruit or veggie is juiced on the spot and consumed within an hour, it's safe. But freshly squeezed juices that sit around for longer than that are too risky for pregnant women to consume. Number 7. Alcohol. According to ACOG, the CDC and several studies, there is no safe amount of alcohol to consume during pregnancy. Even moderate drinking can cause baby to have lifelong problems with coordination, behavior, learning and more. Plus, consistent alcohol consumption during pregnancy can lead to fetal alcohol syndrome, serious birth defects, issues with baby's growth and neurodevelopmental disorders. You might be wondering if common allergenic foods, like dairy and peanuts, also count as pregnancy food to avoid. According to Doro, unless you have a diagnosed food allergy, like celiac disease or oral allergy symptom, common allergen food should not be avoided. In fact, your pregnancy diet exposes baby to a variety of flavors and nutrients while in utero, and, as Doro adds, early exposure is important. Number 8. Raw eggs. Raw eggs can contain Salmonella bacteria. Symptoms of a Salmonella infection include fever, nausea, vomiting, stomach cramps, and diarrhea. It may also cause cramps in the uterus, potentially leading to preterm birth or stillbirth. Foods that commonly contain raw eggs include lightly scrambled eggs. Most commercial products containing raw eggs are made with pasteurized eggs and are safe to consume. However, always read the label to make sure. Make sure to always cook eggs thoroughly or use pasteurized eggs. Number 9. Organ meat. Organ meats provide a range of essential nutrients, such as iron, vitamin B12, vitamin A, zinc, selenium, and copper, all of which are good for you and baby. However, consuming too much preformed vitamin A, especially in the first trimester of pregnancy, can lead to congenital malformations and pregnancy loss. Although this is mostly associated trusted source with vitamin A supplements, it's best to eat just a few ounces a week of meats like liver or kidney. Number 10. Raw sprouts. Raw sprouts, including alfalfa, clover, radish, and mung bean sprouts, are popular in salads. However, the humid environment the seeds need to start sprouting is ideal for the growth of Salmonella, and it's almost impossible to wash off. For this reason, it's best to avoid raw sprouts altogether, although sprouts are safe to consume when cooked, according to the trusted source. How can I make sure the food I eat is safe? As a general rule, the best foods to eat are freshly and thoroughly cooked or freshly prepared. Take care to always store and prepare food safely. Don't eat anything that is past its use-by date. Foods to limit during pregnancy. While there are some foods to avoid entirely during pregnancy, others you'll want to consume in moderation to ensure baby's healthy development. Numerous studies have found that consuming a pregnancy diet full of nutritious and balanced food has led to better cognitive development in baby and lower risk of pregnancy complications, including preeclampsia, preterm delivery and gestational diabetes. To reap these benefits, these are the foods to limit during pregnancy. Number 1. Seafood that's low in mercury. The most recent USDA guidelines recommend pregnant people eat up to 12 ounces of low-mercury seafood per week. Unlike seafood that's high in mercury, these fish, such as tilapia, cod, salmon, trout, catfish and shellfish, are actually good for you and baby. They're excellent sources of lean protein, B12 and zinc. Plus, salmon, trout and herring are rich in omega-3 fatty acids, including DHA, which may boost baby's brain development, Phillips says. But they do have some mercury in them, so keep to 12 ounces or less a week. Canned light tuna is also safe to consume, Phillips notes, but limit your intake to a total of 140 grams per week. Most importantly, make sure all the seafood you eat is fresh and cooked thoroughly. Number 2. Caffeine. The good news, you don't have to give up your daily cup of joe. But you shouldn't toss back coffee after coffee to get you through the pregnancy fatigue. Moms-to-be can safely consume up to 200 milligrams of caffeine per day, according to a COG. This is the equivalent of about 1 cup of filtered coffee. Consuming large amounts of caffeine during pregnancy may increase the likelihood of low birth weight, and, in severe cases, miscarriage, Phillips says. Plus, according to the APA, caffeine is a stimulant that increases blood pressure and heart rates, which may make it risky for pregnant women with existing high blood pressure or anxiety. Speak with your doctor about the optimum levels of caffeine consumption for you before consuming caffeinated drinks or foods, including herbal teas, Phillips says. If you want to drink coffee, I recommend reaching for a cup of decaf to ensure you aren't exceeding the daily amount of 200 milligrams but can still satisfy that craving. Number 3. Herbal tea. As mentioned above, some herbal teas may have caffeine, but you should avoid some caffeine-free herbal teas too. There are not many studies on herbs during pregnancy, says Krieger. Go ahead and stick to decaf black, white or green tea or with familiar herbs, such as lemon verbena, mint or chamomile. But if it's something you're unsure of, don't have it. The general rule of thumb is to avoid anything in excess during pregnancy. In other words, if you have tea, mix up the variety you're drinking so nothing potentially harmful can accumulate in large quantities in your body. Number 4. Junk food. You already know that a balanced, nutritious diet is crucial for pregnancy and healthy fetal development, so it comes as no surprise that junk food, foods that are high in calories, sugar and fat, with little to no nutritional value, should also be limited during pregnancy. Previous studies have shown that high junk food consumption has led to higher birth weights, increased risk of childhood obesity and disrupted sensory development. These foods can carry significant risk to your pregnancy, Phillips says, adding, I have definitely seen these foods negatively impact pregnancies. Of course, having a sweet or fried treat every now and then is completely okay, just make sure that your pregnancy diet consists mainly of balanced and nutrient-rich foods. It can be hard to give up certain things during pregnancy, but trust that it's all worth it. There will be time after delivery to enjoy processed or raw foods, but during pregnancy challenge yourself to explore healthy ways to nourish yourself in your pregnancy, Phillips says. What if I ate a hot dog or pepperoni while pregnant? It's best to avoid processed meats during pregnancy, as they may become infected with various bacteria during processing or storage. Also, they can contain high levels of sodium and additives that don't promote optimum health. Can you eat grapes and bananas when pregnant? All fruits provide essential nutrients and are beneficial during pregnancy. However, it's best to avoid unwashed fruits and those that may have come into contact with contaminated water or other pollutants, such as trusted source melons. Also, ensure you have a balance of fruits and vegetables and don't focus on just one type. Thank you for tuning into this important discussion about foods to avoid and limit during pregnancy. It's crucial to prioritize the health of both you and your growing baby. By being mindful of what you consume, you're taking a significant step towards a healthy pregnancy. Remember, while the list of foods to avoid may seem extensive, it's all in the interest of ensuring a safe and joyful journey through all 3 trimesters. Proper food safety practices, as highlighted by Jennifer Jolort-Doro, are key to protecting against harmful bacteria and parasites. Whether it's avoiding raw meat and fish, steering clear of high-mercury seafood, or being cautious with caffeine intake, these guidelines are designed to promote your well-being and your baby's development. And don't forget, you can still enjoy a variety of nutritious and balanced foods during your pregnancy. So, let your pregnancy diet be a delightful exploration of flavors and nutrients, benefiting both you and your little one. As you embark on this incredible journey, make sure to consult with your healthcare provider for personalized guidance on your pregnancy diet. Your well-being and that of your baby are paramount, and your doctor can provide tailored recommendations to ensure a smooth and healthy pregnancy. Thank you for watching, and we wish you all the best on your pregnancy journey. If you found this video helpful, please like, share, and subscribe for more informative content.